the cancer burden is also increasing, having over 19.3 million new cases, and over half of them die. And it said that over 70% are coming from the lower middle income countries, which Africa also has a share. And to be able to combat this burden, we need competent nurses. Will I say, competent workforce to be able to deliver care to this cancer patient and their families. And looking at in terms of our workforce, they are scarce, especially with oncology nursing. So we saw, and usually people come in with these short courses just to be able to help people upgrade knowledge, to be able to deliver quality care to patients. But there has not been any formal in terms of looking at the impact to the system. So in 2017, there was this nursing forum where we had a lot of nurses trying to comb through what are some of our challenges within our sector. And we saw that we don't have any standardization in terms of practice. And we have other people, there have been strides in oncology nursing. Some countries have started doing training and education in oncology nursing, but there should be some form of standardization across board so that others could also look up on it and then help them to try to also develop their own curriculum to be able to help equip the skills and knowledge of the nurses who deliver cancer care to a patient. So we thought of why not we then develop competencies, have a standard across board where countries can then look up to be able to develop their own curriculum. Because in developing curricula, you need to look at the setting, cultural perspective, you put all together and what is happening within country. So a group of nurses with our international collaborators like International Society of Nurses in Cancer Care, Oncology Nursing Society from the US, came together with the AORTIC nursing group to be able to look at it and then be able to help develop competencies. So we then went out to adopt other existing curriculum and competencies. By the way, we took that of the European Oncology Nursing Society, that of Oncology Nursing Society from the US, the South African Oncology Nursing Society, and that of the Canadian Association to be able to look at it and try to make a bridge to be able to adapt it to our system. And within, there were nurses in Africa who was also involved in this competency development. It has taken a while, for over 4 years. We're able to, after putting all together, we sent to the various, members to be able to review, and then we sent it out to Africans. Not those who did the review were not within our group. They went into academia, different countries. We had about 11 countries with 14 people who were either in academia or in practice to be able to look at it and review it. So they did, the review was more whether we had 4 steps, whether it is feasible, and we also found if it's not feasible, if it's something that cannot be adapted to the system. And throughout, and we had various areas of competencies, about 15 or 16 areas of competencies, and they had to go through. And in looking through, there were just a few comments, more of looking at the community health worker. What can we do to be able to upgrade the knowledge of community health worker? Because they usually may be the first people patient may encounter. And we had to explain that it's also taken care of, because for the competence, we have someone who does not work in a cancer center, like the first level, all nurses, at least some form of knowledge in cancer care. Then we have people who are specialized, but in the specialization, we have levels. Maybe post-basic, after training as a bachelor, some knowledge you need to know in cancer care. If you are working in a cancer environment, then we have at advanced level where there are added on skills they could maybe prescribe some chemos and do other added on skills. So we had these 3 levels. And throughout the review, we only had about 1 or 2 who said in terms of ability to implement, they were saying in terms of resources were limited. There were about 2 countries were saying they couldn't have the resources to be able to implement in terms of faculty. But in all we had a good review from all our 14 reviewers. And the reviewers were all across Africa. We had from North Africa, we had from West Africa, we have from South Africa, we have from Central Africa and East Africa. Try to make sure that they were all part of the reviews. So at this point, the next step is to make an endorsement by AORTIC, and then we move on to other societal bodies within countries, going to the various, will I say, licensing or authorizing from the various Ministry of Health, those in the license shares, those who are able to license nurses, the various schools that do training to be able to look at, to be able to help them to peg their curricula to according to what has been developed. And also then public, to the public, we will be able to have publications so as to reach the other world where they can also replicate what we have done. We did it more of Africa, not just sub-Saharan, because Egypt was also part of the review. And they're also happy to have something like that to be able to look at what they have doing. Now, currently, Egypt is now doing a PhD in oncology nursing. And so they also need something like that to be able to help them standardize their training. Elsewhere, now Africa is we are moving, we are having something that we have equivalent to the nurse practitioner in the US and others. So nursing in advanced, having nurses who are going for advanced nursing skills. So we also need, it's quite important that we need this so that it's standardized. Any nurse that is in Ghana or in South Africa or in Egypt or in Kenya and says is a nurse practitioner, is a nurse specialist, should have an ABC skills which should be cut across all board, irrespective of the cancers that you see. What I want to put across is something that is for Africa, and it's Africans who developed it. And I think it's something that, as it comes within in-country, we are entrenching all who matters to be able to take it up and help us standardize our practice for our patients to have quality cancer care, which they deserve it. And it's a must, it's their right to have it.